This is encouraging news, and I'm cautiously optimistic that it is the beginning of a trend that is caused by the fact that you're all wearing your mask. And we've had an order in place in Dallas County for about the last month. The state joined us a week and a half later, and people have been doing a good job of wearing those masks outside the home when they're around other people. We know that, according to science, is the best way when we're around others to keep from spreading the disease. I'll caution that even with the recent decrease, we're still seeing a record number of COVID-19 hospitalizations. Now, the hope is that, of course, before you go to the hospital, usually you're sick. So we're seeing the numbers go down in sickness, and soon we'll hopefully see the number go down in hospitalization. But really, that's entirely up to you. Will you keep wearing that mask and even step it up and take it with you whenever you're outside your home? You're going to walk the dog, you think you won't see other people, but stuff happens and you find yourself around people. Have that mask with you at all times. I'm not doing it for the press conference, but I normally wear my mask like a chin strap so I can just pop it up over my mouth when I see people. And that's a good thing to do when you're out walking. I know they're a little bit uncomfortable in the heat, but I think more and more of us are getting used to it, and we're finding the ones that work best for us. And so I just want to thank you for wearing your mask and encourage you to keep doing it. Also want to encourage people to not take those unnecessary trips. Now is not the time to go shopping for anything other than groceries and necessities. Now's not the time to go out to businesses, particularly those where you can't wear your mask 100% of the time. We're also reporting 9 new deaths today. Last week was our deadliest week, and this week is shaping up to be a pretty bad week as well. Sadly, today we announced our first preteen death, a little 5-year-old child from COVID. It's important for you to note that this rapidly spreading virus affects all ages. It's not just those who die. We have people, I personally have 3 friends who have, of course, maybe I know a lot more people than most folks, but 3 friends who have been on the ventilator, ranging in ages from 32 to 70 in the last week. With this illness. And so it's a very serious illness, and we don't want you to get it, so please wear that mask and avoid those trips. Let's see, what else do we have? Yesterday evening, Dr. Huang and I sent a letter to Governor Abbott. We have received numerous complaints that there are several businesses, including certain sexually oriented businesses, where masks cannot be worn 100% of the time, i.e. strip bars. And some of these businesses are bars in every sense of the word, and yet they remain open and are at risk of spreading the coronavirus. While the governor closed bars as defined by people or businesses rather, who make over 51% of their revenue off liquor, these establishments make a lot of their money off tips, lap dances, etc., and so somehow they had managed to stay open. We encourage the governor to take action or to tell us why we could not. By 3 o'clock today, we did not hear back. Dr. Huang has signed an order closing those businesses, those sexually oriented businesses with dancers and bars, whether they be the bring your own booze variety or the drink variety. We've closed those. He has also closed cigar bars. It is another type of bar where people can go in and drink and smoke cigars, and frankly it's just not possible obviously to smoke something with a mask on, and so that was another potential super spreader that's been closed. Before we did that, by the way, Code Compliance visited these locations several times, not the cigar bars, but the topless joints. and tried to get them to comply. They failed to do so as far as wearing masks. The governor's order does not address cigar bars and topless, or whatever you want to call these things, topless bars, sexual businesses. And so the public order has gone into effect to close those. There are other businesses, however, that the governor's order does address that we have repeatedly asked him to close because the doctors are telling us they have the potential to spread. I want to go through some of those with you and ask you, the governor has not closed them, so I want to ask you not to frequent them, and let's have a little talk as to why you don't want to do that. In restaurant dining, there's just simply no way for us to eat our food with our mask on. The patio's okay, takeout's okay, delivery's okay, but in this type of spread, it's just not safe for us to sit in an enclosed room with our masks off and have group settings. Further, what we're seeing increasingly is the people who can't go hang out at bars are choosing to go hang out at restaurants and socialize with other groups. Again, a lot of times without mask on because they're eating and drinking. And so again, it's just not safe, and we strongly encourage you not to do that. The doctors are also asking that youth sports not be participated in. There's no way to tackle someone and stay 6 feet away or wear a mask while running at full speed, playing soccer in 100-degree heat. And so they ask that that not be done. We're seeing spread in daycare, and we're seeing spread in all types of congregate settings. So these day camps, to the extent that there's anyone considering going to one of these day camps, we saw a huge outbreak at Latham Springs outside of Waco, where the kids got together. So it's strongly encouraged that you don't go to day camps. Bowling alley, movie theaters, any of these sort of things where there's also eating and drinking, it's really encouraged that you avoid those things if the mask cannot be worn 100% of the time. There are things that are normally healthy things, like a spin class. You just can't get into a room, even if the bicycles are 10 feet apart, and exert yourself at full speed with a mask on. And so even if you had a mask on during that, when you are working that hard, there's about 20 times as much particulate coming out of your lungs as when we're just here talking today. So those things we strongly avoid, and that letter's on DallasCountyCovid.org. We strongly avoid that you avoid those things. Any business, and we couldn't possibly name them all, but any business where people are not wearing their mask 100% of the time. Since July 1st, our second joint testing site has been at the City of Dallas, our second joint test site between Dallas County and the City of Dallas has been at the University of Dallas, which is actually in Irving. And its last day at that location is going to be July 31st, okay? We decide the locations of where it goes next based on data being input into programs at the Parkland Center for Clinical Innovation. We're looking at where are the cases happening, where's the growth, where are the uninsured people without access to testing, where can this be the most effective. Based on that one will move to Eastville College in Mesquite. It will open there on August the 3rd. That location will be for Dallas County residents only. So whether you live in the city of Dallas or the city of DeSoto or Coppell or Mesquite or whatever, it's available to you. If you don't live in Dallas County or Dallas City, there are some tiny little parts of Dallas City that are actually in Collin County. So if you live in that little part of Dallas, come on down. But if you don't live in Dallas City or Dallas County, then this one's not one we're going to be able to test you at. We can still test you at Mountain View, but we can't test you currently at University of Dallas or at the new one in Eastfield that opens August 3rd. That's because we're using CARES Act money that are directed to the county and the city. That's the only people that can test under those. You don't need an ID to test there, like a picture ID, a bank statement, a phone bill, a utility bill, a water bill. It's just about anything that proves you're you and you live here, and you can get tested. We also have, I want to give you some information on evictions, which I guess didn't make it into the notes. So tomorrow is the last day of the CARES Act moratorium on the filing of evictions for people who either have one themselves or are renting a home or apartment where federal money, a Fannie Mae or Freddie Mac loan or other federal money, it was used to purchase the property. However, in Dallas County, we have a moratorium on new evictions until August the 5th. So if you're in Dallas County, those cases won't be filed or heard until August 5th. If you're outside of Dallas County, understand that tomorrow is the moratorium on that. Also, later tonight, maybe by now, there is a new Supreme Court order that you can get at dallascountycovid.org. For those families who have had eviction grace because of the property having a federal loan on it, the Supreme Court has put in, the Supreme Court of Texas has put in some protections to give you a little bit more time to, if you ask for it and follow certain protocols. That will be in their order. So you get some extra workout time. It's in their order. Please get that, understand it. I know a lot of you probably, if you can't afford to pay your mortgage, you probably can't afford a lawyer. But also at dallascountycovid.org are links to free lawyers for people who are having trouble paying their rent or mortgage. I'm not guaranteeing that everybody can get a lawyer, but we have put together a large group of lawyers who, what they call pro bono or free, will try to help you. With that, I will turn it over to Dr. Phil Wong for some other information.
Good afternoon. As the judge mentioned, we're reporting 659 new cases, bringing our total case count to 44,746. And we're also reporting 9 deaths, including the death in the 5-year-old child, bringing our total to 586 deaths. There's actually been a change, and as Judge mentioned, that's the 4th day less than 1,000, so that's great. We're hopeful and that perhaps all the masking is working, but it is absolutely not an indication that we can let up, and that's the message we really need to take. We cannot let up. There's going to be a new normal where masking and all these other things have to be adhered to throughout this. So. But I wanted, the only slides that I have, there's been a change in the way that hospitals are reporting to the state health department, so we have a delay now in getting the monitoring data for hospital admissions, those sort of things that we typically have been reporting. So I'm just going to show this slide. This is the deaths. So this is by actual date of death, which is slightly different. I normally show this at the end of our monitoring data, but just to point out, this is different than when we report deaths at each of these events or daily, but this is adjusted to when the actual date of death occurred, because there is varying delays sometimes in getting those to our office. So either way, you can see that there's an increasing numbers of the deaths. We had our highest number single day reporting a couple days ago, but what it indicates, it has been trailing the hospitalizations. First, after Memorial Day, after a week and a half, we were starting to see the increase in the number of cases. then we're seeing the increases in the hospitalizations. Unfortunately, now we're seeing that increase in the deaths. So that's what we're monitoring for. And right now, that's all we have for today until the State Health Department, they get through that transition in the daily hospital reporting requirements. The other thing, as the judge mentioned, we sent a joint letter to the governor about the need to close certain sexually oriented businesses because these really were, they operate just like bars and so pose the same risk of spreading COVID-19 as the bars that were closed by the governor. And so I issued the health authority order that's actually closing these bars, nightclubs, bottle clubs, and other similar businesses that feature persons that appear nude or semi-nude, and cigar bars and cigar lounges, as the judge explained. I mean, they function like bars. They're settings where you can't have the masking and you have a lot of close contact. And so these businesses must close whether or not alcoholic beverages are served. And so this order is issued in response to complaints that we were receiving about these type of businesses operating in this unsafe environment. And again, since these bars, we've have been shown to increase the spread, and in these settings where you can't get large groups of people, no physical distancing and no masking. Want to just mention a couple other things. The state is moving towards, and we're working with the state on reporting of, in addition, all the cases that we have been reporting have been confirmed cases. There's also a CDC classification for probable cases, and so we're working with the state, and they're planning in the next week or so to start publishing data also on probable cases. So we want to give sort of a warning that we are moving towards that also. Again, reiterate, up till now, we have only been reporting the confirmed cases, which, and so the probable cases have not been included in the counts that we report every day. So we'll try to start doing that next week. We'll provide separate numbers for the confirmed and probable cases so you can tell which ones are which. Just as sort of an explanation, thus the confirmed cases are really those that are confirmed by these, they're called molecular amplification tests, like the PCR test. The probable cases then are cases that are involve either having symptoms and an epidemiologic link to someone who's been confirmed, or also the testing with the antibody tests or even antigen tests. So antigen tests, antibody tests, and you can look up the CDC formal definitions for confirmed versus probable. But again, the antigen tests, those are tests that detect proteins on the viruses. The antibodies detect antibodies where the body's produced antibodies in response to infection with the virus. The ones that we've been counting, the molecular amplification tests, actually detect the DNA, or it's actually the RNA in is present. So those are the difference. Again, just giving everyone a warning, this is coming, and that don't want you to get confused in how those that is reported. So our efforts locally will continue to focus on increasing access to the molecular tests, which is the tests that we provide at Ellis Davis and other local sites. Another thing, the Dallas County Health and Human Services, we've been encouraging, and we've all been encouraging everyone to stay home as much as possible. Keeping people in their homes is very critical. And so we are reopening our application process for our emergency housing assistance program that provides short-term rental, mortgage, and utility assistance to low-income Dallas County residents, those that live outside the city of Dallas who've been economically impacted by the spread of COVID-19 through loss of income or reduction in income. So you can apply, that's opening up today. You can apply online or over the phone. You can look at the details on our Dallas County Health and Human Services website. The applications or these will be accepted until Thursday, August 20th at 4 p.m. And so we're going to process these like we did with the first release by a lottery system. So that makes it so that people who have faster internet or something don't get there first, or that people who have internet as opposed to the people who have to call in and don't have internet aren't disadvantaged because they didn't, get online at the same time. So we're trying to address that. Last thing I want to just mention is in our reports, I think the last Tuesday, Friday report and today's report highlight in that increased number of cases in children. We've been talking about increased number of cases in younger persons, but in particular, we've had over 1,450 children under 18 years of age that have been diagnosed with confirmed COVID-19 just during the first 3 weeks of July. And that includes 29 children that have been hospitalized for COVID-19. Also, we've had 98 confirmed COVID-19 cases in children and staff from 65 separate daycares in Dallas County since June 1st. And that also includes 3 staff members that have required hospitalization, including 2 requiring ICU hospitalization. So again, just another reminder, as the judge mentioned, that this affects all ages and that everyone needs to be thinking about that. So I think that's all I've got.
Any questions?
Any questions?
Dr. Wong, what's the point of probable cases? How does that help public health experts kind of get a sense of what's going on?
Well, the probable cases, question was, what is the purpose of including the probable cases versus the confirmed cases? There is a precise definition for each of those, but the probable cases do reflect probable cases. So it is a more accurate reflection of spread of the virus in our community. These probable cases, they still have to meet some criteria that are detailed, so they probably are actual cases, but they didn't get that particular type of case of testing done to make the standard for confirmed case.
So is the sense basically that we still don't have enough of the exact test to determine confirmed for us to be able to really fully get a sense of how prevalent the virus is?
Well, some of it is not. And we still do have issues with access to tests and the timeliness of the tests. Question was about then. How did you phrase it?
Just I guess the question is, is this an issue of testing availability in terms of the specific type of test that determines confirmed versus the other types of tests?
So the question is about, is this related to testing availability of those type of tests that meet the standard for confirmed versus probable? And it's not necessary. We still have issues with getting access to tests and timeliness of the results getting back for the type of tests that require for confirmed. The thing is, there are more of these testing, the antigen, the rapid antigen tests, antibody tests are starting to be out there also. We've said that we're still learning and they're still developing and improving these tests, so we're not recommending those, but they are increasingly becoming available also. So to recognize that and to use that information to show the magnitude even more of what's going on in our community.
And just to clarify, if someone tests positive for, say, an antigen test and for the molecular test, they're not going to be counted as both a confirmed and a probable case.
Question is, if someone tested positive for the molecular amplification test and, say, an antigen test, that would they be counted twice? And all of these that we've been counting confirmed, we eliminate duplicates. So a person is only counted once, and if they had both the molecular amplification test and the antigen test, they would be counted as a confirmed case because they met the criteria for a confirmed case.
Dr. Wong, in regards to in-person instruction in schools, what would need to change between now and early September to possibly prevent an extension of the mandate preventing in-person operations?
And when we issued that order, noted that we still are, at record numbers of hospitalizations, all of the indicators are at the highest levels they've been. I mean, I think we're looking at all those. And then there's also, again, the advisory group that's been convened with experts, from pediatric infectious disease, behavioral health, superintendent, all these representation that are then advising us regarding next steps after September 8th. And it'll be in the context of again, what we're seeing and these other recommendations from the expert.
Would there be any difference in recommendations between in-person in schools and athletics particularly, or would they all just be essentially grouped together?
I'm sorry, I keep forgetting that's the question. So the question was, will there be a difference between in-school athletics and just in-person learning? I think that that's part of the guidance that we'll be looking and recommendations from the expert panel also.
And specifically, where's the expert panel come from again?
Expert panel is, again, various categories. The judge might have more details, want to share more details on that, but
Sure, you want me to answer a question about that?
any more for me?
Yeah.
Well, you were mentioning that over in July, you've seen at least 1,400 children. Can you talk a little bit of the different cases that we're currently seeing? Are we seeing more hospitalizations among kids, and how serious are the cases?
I didn't hear the first part. I heard the.
Yeah, you were mentioning there's around 1,400 just in the past few weeks, but can you talk specifically about the different kind of cases you are seeing? Are you seeing more of a serious kind, or, the mild symptoms, or what are you seeing?
The question was, in the 1,400 cases that we're seeing, how can I comment more on the seriousness?
1,400 children.
Pardon?
Children.
Of children. And I would say, again, that what we do have is, in terms of seriousness, a lot of that is reflected by requiring hospitalization. And so, as I mentioned, 29 of those children did require hospitalization. As we reported today, we had our first death in a preteen. I think that it shows, I certainly, we're all seeing the highest severity of illness is in those most vulnerable over 65 chronic health conditions. I think what this points out, though, it is not as common, but we certainly have cases requiring hospitalization. And again, today we've now reporting our first death in a preteen. So that's really the main point regarding that.
And what's the age on the preteen? How old was that?
The age of the preteen was 5 years old.
Oh, that was
The
one-
question was, what's the age of the preteen that we're reporting the death today, and it's in a 5-year-old.
Okay. So the kid died yesterday or today?
Pardon?
When did the kid die? Was it yesterday?
I know we're reporting it today. I'm not sure the exact date of death.
Okay, and what would be the advice for parents? I know that you guys were telling them not to go to camps and stuff like that. What would you say to parents who are concerned about the spike on kids?
We know how it's, the question is what's the recommendations or guidance for parents of kids. And the guidance, it's transmitted the same, it's these droplets spread. It's when people cough, sneeze, talk. So the things that we know, if the kids are old enough, over 2, and try to keep people away from crowds, try to keep kids away from crowds. We want everyone universally masking. People around the kids, parents, other people should be wearing the mask. And if the kids are old enough, they should be wearing the mask as they're playing around with their, in their house and whatever. They should be, you want to try to get that to prevent that spread, the droplet spread. You want the kids to be washing their hands and, trying to get them not to touch their eyes, nose, and mouth. You want to try to keep surfaces clean in the household. You want to keep the kids away from others. It's the same thing. You don't want to get big groups. We want to keep people away. And if they are around people, you want to keep them at least 6 feet away. That 6-foot physical distancing. There are specific guidance, for other settings. But it's the same principles, keep to prevent the droplet spread, wash your hands, clean the surfaces, those sorts of things.
And I know you guys mentioned the daycares, about 65 different daycares across Dallas County. Is there a concern that it might turn like the retirement homes that, you know, how are those cases? Are they contained or is it gonna be spread within those daycares? How do you see it?
The question was about the daycares, the 65 daycares that we're reporting, and are we concerned about spread? You know, absolutely. That's what, I mean, when we see them in congregate settings and group settings, we try to investigate those, try to work with those facilities, and you know, there are other agencies that are involved in that regulation and trying to do infection control in those settings to prevent the spread and make recommendations on how to prevent those. Because again, when you get those settings where there are people in, you know, closer confinement, then you want to work with them and make sure that they have practices in place that can help prevent that spread. One other principle I want to mention about, you know, parents, outside is better than inside, you know, in terms of spread. Further distance away than 6 feet is better than closer in. So some of those basic principles too, you know, just in terms of how things are spread.
Thanks.
Is that it, guys? Thank you all.
Thank you.
Hey, and one layperson explainer for y'all. So a probable, we don't need this on this, well, I can do it if there's anybody still listening, but a probable case is usually the family of a person living in the same home, of a person who's had the test, they all have the same symptoms, but they're sick and they're not going to get the test. And it's not because we wanted to report those, it's the state wanting us to. Thank y'all.
Thanks.
Be safe.
So I can just get a tight shot. I have to bring up the slide
Okay.
for the dust. Yeah, thank you.
Can I ask you a follow-up question? Joseph White, Dallas. Sorry, I'll keep my distance. So basically, in regards to in-person instruction, a lot of high school, you know, athletes have been trying to project, like, hey, what's it gonna look like at that date? It would obviously have to be better than the current state, correct?
It would
The COVID situation has to get better between
I
now
was
and
gonna-
September before.
Right.
Yes.
Moved us
Moving us.
to a different story. Oh,
And you know, I mean,
what to, you
in
know?
our
Good.
consistent with our guidance documents that we've had out there, we've read, you know, orange, yellow, green. I mean, sports where you're individual and tennis or something more jogging, you know, that's fitness, you know,
They're doing a, you know, watch party.
yeah, fitness activities and then.
And sometimes a watch party for Rangers.
Tackling
It's opening.
people and
It's
playing
opening
basketball or whatever, I mean,
Always
it's just going and there's,
You know, UIL, Southern Ohio High School Public Schools, you know, had their recommendations, they're gonna proceed this season. Did you have a chance to possibly look at that?
Well, we don't have to
Obviously,
have
they
to
don't supersede anything.
Right,
Just shoot a little
so
bit.
we are, and again, it's
But we can
advisory.
also use energy but
Okay, cool. Did any high school coaches reach out to you or the Dallas County about maybe concerns? I know there's some rural school, for example, that's gonna be really hurt at Sunnyvale High School. Like, they'll be really impacted by this investment the entire season. Did they reach out to you?
I don't think.
Just now?
I've seen anything in particular.